Well, the number of coronavirus cases in England has doubled in a week, with the North East, North West and Yorkshire and the Humber the worst affected areas, according to the latest data. The Office for National Statistics estimates that 1 in 240 people in England had the virus in the last week of September, with more than 17,000 people catching it every day. Our health editor Hugh Pym has been examining the figures.
More testing, part of the drive to rein in the spread of coronavirus. Here at Nottingham University, it's helping students get a quick result if they have symptoms. A sharp increase in infections in some areas is the reason why the government at Westminster is set to announce new restrictions next week. One survey involving random testing of people in the community showed that in a week in the middle of September, there were over 116,000 people infected in England. By the following week, that had nearly doubled to 224,000, meaning 1 in 240 of the population had the virus. In Wales, the figure in the middle of September was about 6,500. By the next week, it had come down a bit, with the proportion 1 in 500 infected in the population. But how well is testing and contact tracing in England functioning? There are fewer people getting results back in 24 hours and fewer of their close contacts being reached. There are reports the system isn't working efficiently. These Kent University students are isolating after 3 tested positive. That's what they told the test and trace system, but they're frustrated to be getting repeated and unnecessary calls.
6-7 times a day I get a phone call being like, oh, you know someone who's tested positive, make sure you're isolating. And then it's just the same call, the same phone call every single day, like multiple times a day.
None of them seem to be in contact with one another, like telling each other that, like, there doesn't seem to be a system put in place to tell them that they've already got in contact with us or that we've even tested positive, because sometimes they call and they don't know that we've tested positive already.
There's mounting concern over rising infections in the northwest, and some of these resulting in people getting seriously ill, with hospitals coming under more pressure. Daily hospital admissions with COVID-19 in the northwest of England were fairly low and stable until the start of September. Then they started rising steadily, with sharper increases in the most recent few days. So what's happening here? Well, this line shows the number of cases per 100,000 amongst the over 60s, and that's been rising at the same rate.
We're obviously concerned, as I think everybody is around the country, with the increasing numbers that we are seeing. In terms of that impact on the hospital, we are busy, but we have plans in place to cope.
At the Western General Hospital in Edinburgh, some patients, thought to be fewer than 5, have died in a coronavirus outbreak in a cancer ward. 6 others have tested positive. It's now been closed to new admissions and discharges. Another example of the potentially deadly impact of the virus.
And Hugh is with me. So what have we learnt today about how quickly cases are going up, Hugh?
Well, Jane, a major survey, regular survey, a week ago was suggesting that the rate of growth of the virus might just be levelling off, but it's saying something very different now. This is the Office for National Statistics saying that the virus is increasing rapidly, doubling in England over the most recent week it covered. Another survey by Imperial College London giving a similar sort of outlook and saying that these high infection rates in the north of England might possibly be replicated soon across the whole country. Now, the thing about these surveys is that they cover a section of the population who don't have symptoms and who haven't come forward for tests, not just those who want to go and get tested. So that is very important. So what does all this mean for the next few weeks? Well, it might suggest that restrictions introduced a few weeks back haven't had the desired effect, which is why the government, as we've been hearing, is planning more for England. But the problem is hospital admissions, which, as we've seen, are rising rapidly in some areas. They relate to cases going back 10 days or more. So anything introduced next week will take a while to take effect. People who've already got the virus may well become sick, a certain number of them, and that will push admissions up even further. And that is what the NHS is concerned about.
Hugh, thank you. Hugh Pym.